Now I'd like to talk about the medical conditions, or the medical diagnoses, I should say, that the Formthotics are very beneficial in using to help reduce those pain symptoms. And most of the diagnoses are pain symptoms. When you have a diagnosis such as plantar fasciitis, shin splints, posterior tibial tendonitis, medial knee pain, jumper's knee, hip pain, bursitis, they're all describing pain. So what we want to do in our discussion and our evaluation is to try to determine why is that pain there. And one of the reasons we've discussed and will be discussing more with a patient demonstration is overpronation. I think one is clear in the literature as being a big culprit as the etiology of those pain symptoms that we've talked about. There's been several good studies out. Two come to mind, Larson and Landorf. Larson's study, as I mentioned before, that it actually showed a 20% reduction in low back pain using the Formthotics and 10% reduction in shin splints in military recruits. Landorf actually talked about plantar fasciitis and how the Formthotic actually reduced pressures under the foot and created less heel pain, but in addition to that also helped to improve lower extremity function and reducing pain throughout the whole lower limb. When we look at the limb from actually the hip down to the foot, we're talking about a closed kinetic chain. We could actually even include the lumbar spine. As Inman described a long time ago, rotations occur from as high as T6, T7 because of our reciprocal moving gait. Those rotations filter all the way down into the pelvis, into the hip, down through the femur, into the knee, down through the tibia and into the foot. The foot is your torque converter. I think that's the best way to describe what we're trying to do here by using the Formthotics, is controlling that excessive torque, which is a twisting movement. The foot can't turn from side to side as we walk, so there has to be some conversion of that rotation, and it occurs in the subtalar joint. What is the best thing that this product does is control pronation at this subtalar joint. That is our torque conversion joint. So conditions such as hip pain, even low back pain, as Larson demonstrated, right? Hip pain, again, knee pain, which has to do with the control of the femur because it's part of the knee, and the tibia, right? Medial knee pain, patellofemoral pain, right? And there's all different diagnoses for that. Jumper's knee is considered chondromalacia of the patella. All sorts of wastebasket terminology to describe this knee pain, right? And then we go below the knee, and on the medial side, we have a bunch of syndromes. All on the inside of the tibia is the shin splints, which is, again, a general term, a wastebasket term. Some more specific, which describe the posterior tibialis syndrome or tendonitis, goes into the foot, the posterior tib. Then we have medial arch pain. We have Achilles tendonitis. And again, specific to the medial insertion of the Achilles is a common area of problems. There was an article published a while ago that by Michaels describing a soleus syndrome. The medial 1/3 of the Achilles tendon is made up from the soleus muscle, the lateral 2/3 from the gastroc muscle. I see much more medial Achilles tendonitis, medial arch pain, plantar fasciitis, which is, again, medial heel. That's where most of the plantar fascia attaches to the medial heel. And then we go into the foot, we see arch collapse, mid-tarsal collapse because of rear foot problems. We see metatarsalgia, sesamoiditis. The orthotic can make a big difference. Most of the time, I think of it as part of your treatment, right? And then other times, it could be the main focus of treatment, especially conditions in the foot. Plantar fasciitis, heel pain, medial arch pain. So the closer we get to the foot, probably a more primary treatment. The further away we get from the foot, probably a secondary treatment that involves taking care of other deficits, other etiologies for those overuse injuries. So again, we have a really good product that is going to help improve the care of our patients by allowing them to function better during the day or improve their performance in sporting activities.